So this is an example of interscapular pain. And when we palpate down along the ribs, we find a prominence. This is the bottom of her scapula. And we find a prominence right here. This rib is much more prominent than on the right side. And I'm going to spring the ribs in this direction, so I'm going medially, okay? So I come below that level, and I can take up the slack and I can spring these ribs. So I make my way up, and you can see the body bounce. And then we come here, and I'm using more force. I'm doubling, tripling the amount of force, and there's no movement here. This rib does not move. And then I'm coming to the next one above it, and the one above it is stiff, but I can get, I don't know if the camera, if you can see it, but there's a little tiny spring, a little tiny bit of recoil. So there's a little movement in the rib above that. And then when we come above that, there's definite spring. Okay, so I think it's rib number 6, might be 7, might be 5. Have no way of validating what number it is, but I can certainly identify the rib that doesn't move. And the treatment is exactly that. You gap it anterior. So my first direction of force to treat it is going to be straight down towards the floor to gap that rib off the vertebrae. And then I want to rotate it. I believe this is a rotational injury, so then I'm going to add a vector at about 45 degrees medially. Okay? So I'll start off pushing straight down on it, and then I'll change my vector at a 45 to restore mobility. Now, when we test springing on the left side of her spinous processes, we have good mobility. And this one positionally feels indented, okay? And there's a subtle cue there that maybe it moves a little more than the one below it. It's subtle. There's a subtle cue, and what it tells me is that I'll probably find something on the opposite side, which we did find. I already did this testing, and so I'm well below that, and I can spring the spinous process to the left. And when we get right here, there's no movement. Okay? And if we palpate, I note that the spinous process points out to the right. So there's a difference there. This spinous process points out relative to the one above it, and it points out to the right relative to the one below it. You can see that my thumbnails would overlap. Okay, and so the vertebrae is rotated to the left. The front of that is rotated left, and so the little bump on the back, the spinous process, then points to the right. Okay, and so we talked about how I'm going to treat the rib, and the way that I'm going to, if I have to, maybe freeing up the rib will free up that rotation in the thoracic spine. I always treat rib first. If it doesn't, if the vertebrae still appears rotated and not moving, then I'm going to have her side bend to the right. So, yep, turn your body to the right, turn your head to the right, and I will then capture that vertebrae and the one above it, and I'm pushing at an angle of about 30 degrees above horizontal. And I capture, again, the vertebrae above, the vertebrae below, and the one that doesn't move in the middle. And I just engage it, and I push on that for 3 minutes. And it's a very effective treatment. It's a difficult one to do a self-treatment with. It's a bit challenging, but the good news is this is usually a one-time treatment with the Hesch method. I know there's other manipulative methods out there that require you to come back. But by being thorough and treating the thoracic rotation and treating the rib restriction and holding that release for a long time, I feel like we're a lot more effective. So I'll stop filming now. We will treat you and we'll come back and film the response.